Hello. I think we will get started. Looks like a lot of people have joined us. So if this feels like a good natural start, I feel like for people that work in person, face-to-face, this Zoom format and how we're used to doing Seeds of Hope in person, this feels like a little bit of a change, but we'll just go with our Zoom format here. I guess we should be used to it after all this time. So I just want to welcome everyone and thank everyone for joining the Interfaith Counseling Center tonight. Myself, Dr. Ranney, and for this year's Seeds of Hope event, certainly different than we've done in the past. But with that said, we're thrilled to have this format and to be here tonight, and have so much appreciation for everyone who's here, for you, and for everyone that made this possible. And I really want to extend appreciation to our staff and all the people we have worked with in the past and over this past year for the wonderful example of resilience and perseverance that we've witnessed through this time and with what we've all been through. And with that said too, I want to have appreciation for this time of a little bit of normal coming back. That feels exciting in this season of spring and growth and hopefulness. And we have the fortunate experience of meeting you, Dr. Ranney, our new friend and supporter. So we're really excited to have you with us. And I want to thank you for your work and your dedication and service to the health of all of us during this time. You have really been here for Rhode Island and everyone here during the pandemic. And thank you for being here tonight to raise awareness for mental health for the ICC and for how mental health has impacted, how COVID has impacted our mental health. And also for helping us raise funds to continue this important work. And I just I'm going to, if it's okay with you, I'll kind of share your bio and then let you kind of take the more personal end of an introduction. Does that feel okay?
Fine.
Okay. And I want to remind everyone to feel free to put questions in the chat. I think there's like a space for questions or the chat. And then we'll probably open it up. We'll open our conversation up to questions a little bit later. So I'd like to give you a very formal introduction because of your very exciting things that you're part of. So you are the director of Brown Lifespan Center for Digital Health, the Associate Dean of Strategy and Innovation for the School of Public Health at Brown University. And you're an emergency physician, researcher, and national advocate for innovative approaches to public health. Your federally funded research focuses on developing, testing, and disseminating digital health interventions to prevent violence and mental illness. Dr. Ranney also serves as the Chief Research Officer of Affirm Research and is President of the Board of GetUsPPE.org. You are the editor of the Annals of Emergency Medicine, a fellow of the 5th class of Aspen's Fellowship Program, and a member of Aspen's Global Leadership Network. You are also received numerous awards for technology, innovation, public health, and research, and Dr. Ranney is a frequent media commentator on outlets ranging from CNN to the New York Times. And we are so thrilled to have you here tonight. I'm super excited to continue conversation with you as we've started. And if I can turn it over to you to kind of give us our more personal introduction of
Thank you.
The how and the why of your work.
Absolutely. So I think when I start with the how and the why, the first and biggest part is that I am an emergency physician. So I came to Rhode Island a little over 17 years ago to do my training in emergency medicine at Rhode Island Hospital and have never left. Just fell in love with Rhode Island. And my work as an emergency physician at Rhode Island and Miriam primarily, although also at Hasbro in non-COVID times, really is the driver of so much of my work. After my residency, I did a fellowship or kind of like 2 additional years of training in injury prevention. I had always worked in the area of kind of violence and mental health. And that was actually the point where I first got linked to the Nonviolence Institute, which was how then I got linked to you. Started working with them, almost 15 years ago now. And as an ER doc, right, I see both the greatest strengths of our community and the greatest areas of challenge. And that's what brought me to be a researcher, was the desire to not just treat people, but also to figure out kind of bigger fixes, societal fixes that we could put in place, or ways that we could improve the healthcare system or the larger safety net and social support system. And that's what brought me to do the work, I think, which is one of the ways that you got to know me, is through my work on COVID over the last year. Although I went into medicine thinking I was going to do infectious disease, it's not where I spend most of my time in non-COVID years. I really do most of my work really on that kind of issue of violence and related behavioral health problems. But COVID, like every other health problem, is so deeply intertwined with so many of the structural disparities and barriers in our society, ranging from racism to lack of access to healthcare, to lack of access to good food and exercise, to lack of access to good information. To just the general dysfunction of our public health system, although we in Rhode Island are relatively lucky. So it was just a natural calling for me to work on it. And I'm looking forward to the pandemic slowly ebbing so that we can get back to work on these underlying crises that have only worsened over the last year.
I was wondering what words you were going to use after getting back to slowly ebbing. Okay, that feels hopeful. Slowly ebbing, that feels cautiously hopeful, right? As we continue all the things to keep ourselves healthy and safe in this time.
That's exactly right. It is. I mean, I am absolutely optimistic about the future, especially here in Rhode Island, where so many of us are getting vaccinated. The latest stats are about 40% of Rhode Island adults are fully vaccinated, which is just tremendous. We're kind of in the top, that top tier of states in terms of our vaccination, and that's really the key to things getting back to a closer normal. But slowly ebbing is appropriate because I cannot provide a wholehearted, everything. COVID is not going to go completely away. I think it's going to be with us for a long time, and we're just going to have to adapt for it.
I know most of the people, or many of the people, I should say, with us here tonight know about the work of the Interfaith Counseling Center, but I'd like to just kind of give a brief overview, which kind of relates to our conversation and your work as well. So we provide mental health counseling and case management and referral services for all in need. We work to remove any barrier to care, and it's a really important part of our mission to diminish stigma and to make care accessible to all. And particularly over this time of COVID, we've worked really hard to try to find ways that people can be supported in community, in their own communities, have their mental health supported, and by doing that through various programs and helping to make referrals within people's communities. We have many great providers within Rhode Island, so we provide services within the Interfaith Counseling Center and then also make referrals to lots of different places. And sometimes we do the work of helping people decide where to go, if not the emergency room, or where to go post the emergency room or post a program, and help people walk along that path of getting connected to the right level of care, which is often a process and can be confusing and can feel like a lot of doors are closed in that process. So having our staff kind of walk alongside of people for that process, we hope to destigmatize and also help people get engaged in the care. And we have seen over the course of this past year, probably a 30% increase in our calls, not necessarily all people needing mental health counseling. We worked with the governor's office and the Department of Health to create a network of connecting people to faith community leaders, if that was something We found a lot of people struggling with fear, lack of hope, feeling kind of untethered, and we consider spirituality part of one's health, and so addressing the whole person. And if for many of our clients, faith is an important part of their lives, and so it's always something that we honor and respect if brought forward, but not something that will necessarily, we don't introduce that. So that makes sense.
I love that. And I have to say, Christine, that, as an emergency physician who sees so many people who come in because of sometimes an acute mental health crisis, but sometimes it's just been something smoldering for a long time that they finally feel that they can't deal with alone anymore. Your organization provides a lifeline, and I mean that in the truest sense of the word, to many folks. As you said, the system as it exists is confusing even for those of us that work in it, much less for someone who feels overwhelmed by every aspect of life. And so on behalf of my patients, I really thank you and appreciate the work that you do.
Thank you. Thank you. I feel, and I know you will appreciate this, that when someone finally gets to the point where they can make that phone call, go to the ER, it's been smoldering, they maybe have talked a little bit about it with family and friends, or maybe not, that's a really important window of opportunity. So it's really important to us at the Interfaith Counseling Center that we respond to people really quickly. And even if we can't help them get into care, that we be a warm holding spot and a warm, friendly space, that there is support until you get to that next level. And I guess something that I'm interested in your thoughts on are, so through this time of where we've relied on different ways of connecting, different ways having telemedicine, telehealth, connecting by Zoom and Doxy and all these things for appointments, what are some things that you think we may carry forward from learning of this time that would help us maybe increase engagement or help people move along?
Yeah, so I think the first and biggest thing that I hope that we retain is a willingness to talk about mental health as just a normal part of life. I feel like there's been a more open discussion about anxiety and loneliness and depressive symptoms and frustration and hopelessness than I've ever seen. And I've seen, that discussion kind of that there's not the stigma with admitting that you're struggling right now.
Yeah.
In a way that, if I went back to last January, it was something you just didn't talk about. So that's the first thing. If we do take nothing else away, it's that normalization of the fact that this is a journey and one's mental health ebbs and flows, and that you need supports around it, and recognizing that these stressors or removals of social support are going to worsen your mental health, and that sometimes life happens. And then that's about kind of calling on those around you. The second thing is the use of tele support. So whether it is video or phone calls, I don't expect to see it stay for much of medical care. There are certainly parts of medical care where, as a physician, I want to lay hands, and kind of there is an aspect to physical touch, both that helps me diagnose, but that is also healing. But for treatment for behavioral health problems, for mental health treatment, for substance use disorders, the ability to have video or telephone visits I think is going to stick around for a lot of people, and particularly for a lot of the patients that you serve. There are issues around transportation. There's issues around stigma with going into an appointment. There are fears about safety. Some of the community, and will say kind of, I'm fully supportive of our community health centers and of Providence Center and Gateway. But for some patients, that process of getting there and going in feels deeply uncomfortable, not just from a stigma perspective, but this feeling of, I'm around people, I'm labeling myself. And so I think there's that aspect of telehealth as well. I also hope that we're going to see greater innovation or commitment to other aspects of digital healthcare. And obviously I direct our Brown Lifespan Center for Digital Health, so I have a bias here. But I will say that much of my work, and you and I have talked about this before, most of my work is with adolescents. So adolescents who've had physical fights or who are depressed or who are experiencing post-traumatic stress. And one of the things that we found is that when you provide them with digital check-ins that aren't necessarily a real person on the other end, it can be totally automated and computerized. But when you provide these kids who just need a connection with a daily check-in, asking how their mood is, asking whether they've gotten in any physical fights during the day, providing them with some pre-written guidance, they do better. They have less stress. They have better social. They report stronger social support. They demonstrate various measures of greater resilience compared to kids that get nothing. So I think in COVID, although, I can't wait to see, you and I met in person outdoors last week, and that was so lovely. And I was joking with someone yesterday that there's like the people, my 3D friends, and then there's my people that are my 2D friends, like that I only see on Zoom right now. I think there's huge value to 3D, but for some, there are some conditions and some people for whom that digital care can be a bridge or an adjunct to other forms of treatment. It also can help to extend our workforce. I know that you guys at Interfaith Counseling Center, as well as just about every other group that provides any form of mental health or behavioral health care in the state, is overstretched. And so some of those automated or digital techniques can help to extend your workforce. And then the last thing I'll say there is that sometimes when I talk about digital, people say, well, what about the digital divide? And how can you talk about this? Our most at-risk patients aren't going to have cell phones or aren't. And so there is a true digital divide, particularly around access to broadband and laptops. But the data shows that regardless of race, ethnicity, income level, education, the vast majority of American adults, somewhere around 80%, have a smartphone. And it actually doesn't differ according to socioeconomic status, or any of the other kind of markers of potential inequality or disparities. So cell phones, if we can adapt our treatment to those, can be a really great adjunct. So I hope that will stick around, but I also hope that we go back to seeing each other in person a little more, because I miss it.
I love the idea of bringing in that dimension of check-ins, because I think extending the in-between time, and the kind of building a practice of checking in with ourselves on our own mental health care. And I think those, like a digital reminder of a text or something, could help. And I think something you mentioned about, that we're all talking about mental health now, whereas before COVID, I feel like we were still in the, you either have something wrong with your mental health or you're good. And I think, we've all experienced elements of, the continuum of mental health. And I think that's been a really, really important experience that I really hope we take forward with us, and that we look at not mental health as something we only talk about when something's wrong, but that our mental wellness that is part of everybody's everyday life. And I'm hoping that creates more connection between all of us, and that is seeing our shared humanity in all that. We over this time used some great grant funding that we got from the Rhode Island Foundation to get tablets and cell phones, so that we could have those available if people, for when people needed them to make connections for either digital health or connect with family and friends. Or so I felt really fortunate that we could be able to offer that within this time. So I'm thinking about too, as we think about adolescence and our younger people being stressed as school is changing, and not, I think, what should we ask first, like the impact of our kids or the impact of our adults, and then what's happening as our adults are stressed out and our children are stressed out.
Right, right. Well, and I think they are so interrelated, right? We know the impact of family dynamics and the impact of parental mental health or illness on kids. We know also the impact of witnessing domestic violence on kids. And so, when you take a pandemic, which put a lot of families under economic stress, many experienced food insecurity. Thank goodness in our state, housing insecurity was lessened a little bit, thanks to protections around evictions. But you also had folks in a house with each other 24 hours a day or in an apartment who normally would not be spending time together. That was a tremendous stressor. We've seen increases in alcohol use and alcohol withdrawal. So especially during the shutdown when people couldn't get to alcohol to liquor stores, we saw a dramatic increase in the number of patients in the emergency department who were going through acute withdrawal. We've obviously seen an increase in opioid overdoses, particularly after the shutdowns got lifted last spring, but it's continued to rise over the last year. Seen an increase in firearm violence. Thank God, as of right now, it doesn't look like we saw a significant increase in suicide per se, but we certainly had an increase in suicidal ideation and in mental health related visits to the emergency department over the last year. And we saw that in kids too. So you have all those stressors on parents or on adults or other kind of caregivers. And then you put the kids in, and then you have kids who depend on school for either social contact or for a safe place to go or for a warm place to go or for their food during the day. You have kids that are home with parents who are stressed out. If the parents don't have great coping mechanisms and if they're fighting with each other or if they're fighting with the kids, you're losing those mandated reporters at the schools. So we saw an increase in severe child abuse actually this year. The kids that did make it into the ER were much more kind of badly hurt, sadly, because they weren't going to school. So there was just this tremendous knock-on effect. And then even for kids that were part of stable, families that weren't struggling with severe mental illness or home violence, I don't think there's a single family out there that wasn't stressed this year, whose kids, these were tremendous transitions. We went from normal life to nothing. We had kids lose all of their graduations and proms and school plays and athletic meets and final exams and summer camps and name the event that kids mark the year by, it was gone. And for those of us that are in our 40s or 50s, fine, I missed a summer, it was horrible, but whatever, it was 1/50th of my summers, right? But for a kid, that's like a quarter of their summers or an eighth of their summers that are gone. And so it's just, I think it all felt more momentous for them and felt more permanent. And now, right, so now all of our kids are back in school for the most part. And so now we have another transition to usher them through. And I always think I'd be interested in your perspective on this, but right, when I think about mental well-being, one of the things I often remember is a freshman year psychology class graph around some of the most stressful events in life are sometimes some of the happiest things. So marriage or buying a house is just as stressful as a divorce. And so I think we're going to watch that kind of pain of, or my father used to say that it's the heat of reentry, like when the space shuttle re-enters the atmosphere from space, that there's that heat of going from space back into Earth's atmosphere. That the outside of the space shuttle heats up. And I think we're all going to be experiencing that over the next month or two, that heat of reentry into normal life of I have to go out to dinner with people. I have to see my in-laws, whatever. My kid, my middle schooler was like, Mom, do I really have to get up and go to school 5 days a week? Yes, you do. Right. And so I think we have to be prepared for that other set of transitions. And if we as adults are not kind of stable and able to cope and manage our own stress, then we're never going to be able to help our kids. So it's it's a lot of both. And the data backs up that both adults and kids are experiencing significant stress. And then again, unfortunately, our system is just not set up to provide care that moves people to emotional and mental health, for the most part, with exceptions like your group.
Oh, thank you. I like that, the heat of reentry.
Used to say it after we'd come back from vacation, when I'd be like, I don't, that after like a summer vacation or a school vacation, I'd be like, I don't want to go back. It's like, Megan, it's the heat of reentry. And I think about it. Yeah.
Yeah. Because there is a lot of, I think, excitement and interest of going back to being more normal, but then also some lean away, I think, of we've gotten used to how things are. I know the first thing I went back to do in person, I thought, do I know how to be around people face to face? Am I going to be able to make eye contact besides, I've gotten used to this format, so I think that's a really, when I think about counseling, if you're used to having telehealth and then you're back in a room one-on-one with someone, that I think there'll be a lot of transition. And I also appreciate the idea of, how do we support our wellness? And that's a thing that I think I've been pleased to see that we're all talking about now, and using coping skills, and what tools do we all have? Are they connecting with family and friends? Is it mindfulness? Is it therapy? Is it jogging or walking or listening to music? What is it? But that this time, I think, has kind of asked us those questions. So I hope that as we move forward, we don't just all plug back in unintentionally. I hope that we move forward with intention of what we're placing back.
I love that idea of kind of how do we create intentionality for ourselves around what goes back in.
Yeah, I'm interested also, thinking about the things we've seen increase, and, things that are, really concerning. And what do we all do? What do we as community members, trying to support one another and feel like we don't know what to do? Like, what do so what do you, I guess from your perspective of some of those challenging things, what do we do?
Other than donate to the Interfaith Counseling Center?
I didn't tell you to say that.
No, you didn't. But I think that is a great way to do something and to make yourself feel like you're making a difference. But so outside of that, so honestly, other than monetary donations, I think one of the next things is volunteering. I think that I know that volunteerism, in a sense of being tied to something greater than yourself, whether certainly, it could be volunteerism within a faith community. So within your spiritual tradition, volunteering there, or volunteering with a community group, those senses of being tied to something bigger and of making a difference outside of your own family are huge predictors of mental well-being. Social support. So, and for those of us that have strong social support networks, reaching out to those who don't. I would say early in the pandemic to, check on your elderly neighbors or on the folks that are isolated that don't have transportation, make sure that people have food, mow their lawn for them, right? And that still holds true. And I think even as we come out of the pandemic, that sense of checking on your community around you matters. So donate, volunteer, check on the people around you. And then the last part is like, what do we do if we notice that someone's struggling? And I feel like that's something that's very uncomfortable for most of us, especially in this very individualistic culture that we live in. There's this sense of, well, I don't want to kind of get in their sauce. Like, I don't want to imply that something's wrong. I may be misinterpreting.
Right.
And I think there's a fair amount of literature saying that just checking in and being like, hey, if you know someone even a little bit, are you okay? Or if you witness something. So again, especially as we go back to normal, there's a whole body of literature and really kind of evidence-based interventions around this idea of bystander interventions, which are particularly pertinent for if you're witnessing sexual assault or hate crimes or overt racism, but can also be helpful when you witness things that are a little more subtle, which is, you know, you step in and you distract, or you help someone kind of step away and get to safety. You delegate and you ask someone else to get help. And those little interventions can make a difference. And I will say, you know, as an ER doc, and I'm sure that you've heard these stories too, Christine, the number of patients who I've taken care of who have said, you know, the thing that got me here, instead of having me overdosed or dying of suicide or whatever, is that someone asked if I was okay. And there's one story that always sticks with me, which is a woman who checked into a hotel with the intention of taking her life. And when she checked in, the hotel clerk said to her, how are you doing tonight? And then said, I hope I'm gonna, you know, we have, it was like a Hampton Inn or something. So he was like, you know, we have cookies down here every night at 5 o'clock, and I hope I'll see you there. And she went up to her room and she sat there and she started crying, and she called her daughter, and the daughter brought her into my ER.
Wow.
And so I think about that because, you know, there are these bigger things we can do, but there are also these really little things, and you never know when you're just kind of smiling at someone or saying something, doing that very simple sort of bystander intervention will make a really big difference.
Yeah. And the dual benefit of that for the other person and for us, of that reaching out to someone else and offering you know, the purposefulness of checking in with someone else is good for both parties' mental health.
Yeah.
Right.
Very much so.
Yeah.
I mean, I frequently, and I've said this to you, but like, I mean, when people ask me kind of how I got through the pandemic and how I maintained my own hope over the course of the last year, 15 months, it was absolutely about feeling like I was doing something, whether it was being on the media or whether it was through Get Us PPE or through other work. It was that sense of like, I had something that I could put myself into that I could feel was making a difference bigger than me. I couldn't control governmental mask mandates. I couldn't control the availability of testing supplies, but I could control the fact that I was volunteering. I could control the fact that I was kind of speaking out around kind of what the science meant. And the people that were part of Get Us PPE, many of them were not healthcare professionals, but they could show up and sew a mask or kind of do something else. And I just, that was my trick for getting through this. I don't know. What was yours?
Yeah. I was thinking M&Ms.
Totally fair.
Yeah. And I definitely agree that sort of the purposefulness and feeling, you know, my work keeping me connected to, you know, being connected to my family, and then my work connecting me to feeling like I was participating in the bigger world, even though we were shut down.
Yeah.
And then as we move forward and really, you know, I think all of the Interfaith Counseling Center, I know all of our partner organizations, the Nonviolence Institute, Project Outreach, the Providence Rescue Mission, the Transitions Clinic, like all the partners we work with really, I think would probably share those feelings and see the importance of keep our community layers, however we could do it, whether it meant Zoom or text or dropping things off for people that, you know, kind of keeping that purposefulness and connection to others. And that shared experience of we're all maybe impacted differently, but still having part of something larger than all of us, although, you know, certainly people had such varying experiences and how they, to the degree that they were impacted.
Yeah. And I also, like, as you're saying that, I'm sitting and thinking about my friends who've reached out to me recently. So I also want to say it's okay if you did nothing during the pandemic, if you like, or didn't do nothing. If you were like home and playing board games with your kids or reading books or eating M&Ms or making, you know, whatever. I've actually talked to a bunch of folks recently who said to me, you know, people have said that they felt like hopeless or useless at the beginning, but now this time, in some ways, this was a pause. And so now I've talked, like I have one friend who's decided that she's going to run for political office because this was like this moment where she was able to sit and ponder and figure out what her next step was. Another friend who is going to be changing careers. Like, I think, and then there are other people that built a different relationship with their adult kids or with
Right.
their parents or kind of whoever they were home with their pets, you know?
Yeah.
So I think that pause is also an okay thing if that was right for you. But yeah, I'm with you that, like, obviously I think the way that you and I exist in the world is that kind of sense of service. So
yeah, I think the having the perspective of looking at however we moved through without judgment and just accepting it for it was what it was, and here we are now, and that different people will lean into different parts of this in different ways. I know I do feel a little like on the more hesitant side of like, what's it going to be like? And I'm not sure. And I'm not used to that many people. And, knowing other people who can't wait to, dive back in. And it takes all of us, right? It takes all of us and all kinds of personalities and people to make it all go round, I think.
yeah, yes.
Yeah.
Well, and I think that is an interesting, as we talk about kind of the reopening process. I'm going to a dinner tomorrow night with a bunch of other vaccinated people, and it'll be my first indoor dinner with anyone outside of my family.
Wow.
In 15, since last March.
It's just the idea of, yeah.
Right? Like, there's this like, I went to a meeting, an outdoor meeting, but with kind of other people who again were fully vaccinated, and we were like, we can take off our masks, right? Because we're fully vaccinated, and we know, like, we were all in like public health and medicine. We were like, we know that this is safe. We're all vaccinated. We know we're outdoors. It's fine. But there is this sense of, this feels really uncomfortable.
Yeah.
Right. And I think giving ourselves space for that too, for again, that heat of reentry, or like this discomfort of where we're going to land. And it's going to be interesting to watch to what degree. I was just having a discussion with someone about our meeting rooms. Are we all going to need to retool so that some people can be remote and some people can be in person, and we can have a video, like all of the teachers did this year with a half remote, half in-person learning. It's going to be super interesting to see where we all land in 6 months.
Yeah. And how as we move forward, people feel included or excluded because of being in person or on a video or on a call, and how we kind of, put all those pieces together. And now, because I think as we've seen moving, the slow flow forward, that it is an interesting, I know one of my kids with the remote learning saying, like, I'm looking from like this little tiny bird's eye view in the back. I can't see the whiteboard in the front, just that, and sort of, that idea of when you're on the outside of something and you can't see the big thing in front of you, that I think that will happen on many levels.
Yeah.
Through this. So I wanted to ask you also about, I think we often talk about the interplay of body and mind. So how has the stress of this time impacted, do you think, our physical health? And then the things that have happened with our physical health, how has that impacted our sort of mental and emotional health?
So
like a big question.
The mind and the body are, the whole, I say it frequently to my patients, which is that the mind and the body are deeply connected. And when you're stressed, or when you're depressed, or when you're anxious, the chemicals that your brain releases or doesn't release affect every other part of your body, your gut, your heart, your muscles, it's all deeply interrelated. And this year has been a struggle for both the body and the mind. I think there was a period for many of us, right, where we were looking at our Fitbits or our step counters and going, oh my gosh, I'm like, there was this thing on this thread on Twitter at one point where people were like, I got 111 steps today.
Yeah.
Because you just sit all day there.
Yeah.
You're not going out to the grocery store. You're not walking to the office. You're not going to your kids' games or whatever. So I think our bodies took a hit, and a lot of people had back pain and sleeplessness, and then the mind then affected the body. I also think that the winter, right? So having the worst of the pandemic be during the winter months was particularly difficult. Last spring, when the pandemic hit, at least it was getting warm.
Yeah.
So we were able to do things outdoors. We were able to get out and go for walks. I live close to, I live relatively close to the high school in East Greenwich, and there's this nature path behind it. And I remember in the early days of the pandemic, going out midday for a walk, and like, it was just there were so many people because nobody had anything else to do, and it was a safe space to go.
Yeah.
And I hope, I don't know, I don't have answers here, except for to say that if you ever doubted that the two were connected, this year has proven it. Right?
Yeah.
And I think we're all going to have work to do in rebuilding both. I look at the degree to which people have missed preventive care over the last year: mammograms, colonoscopies, dental visits, kids' pediatrician visits, and their normal kid vaccine schedule are all, those are all thrown off. We have to make up for that. And then at the same time, we have to care for our brains and our minds and kind of that larger spiritual and emotional health, if we want to allow our bodies to heal. The last part that I'll say is for those who have had COVID or who have family members that have been through COVID, COVID itself affects both the mind and the body. One of the things that I find most interesting about COVID is that one of the early symptoms for many people is loss of taste and smell. Those nerves are directly connected to the brain. And we've seen a high incidence of neuropsychiatric side effects in people that have COVID, even people with mild COVID symptoms. And my own sister is a physician in another country and caught COVID over the winter, and still lacks her sense of smell. And I think acknowledging that too, and the healing that has to go on for folks that have made it through to the other side of COVID and have those both physical and mental side effects, is also part of it.
And where, when we recognize that, we may see that in people, because COVID has been something we've responded to with our testing sites and the doctor tents outside and the field hospitals. When there are those symptoms that may be presenting as neurological or psychological things, where are we telling people to check first with their physician?
A great question, Christine. I don't think we're telling people to do anything. I mean, there's not much, honestly.
You're deciding tonight. You're telling us.
Yeah, so it is a great question. So I would say certainly check first with your physician. But know that there's not a lot of evidence-based treatments right now. So for kind of the post-COVID symptoms, there have been some anecdotal reports of people getting the COVID vaccine and then feeling their long COVID symptoms resolve, which would be lovely if it's true. I don't, anecdote, not data at this point. But I think checking with your primary care physician first is a good call. If it's not kind of lung problems or kidney problems as a result of the COVID, we don't have clear medical treatments, but I think therapy is never a bad thing, right? Getting counseling will never hurt, and can only help. But yeah, I would say check with your doc first and then go from there.
Yeah, thank you. I wanted to just touch on, and then I want to get to some questions, but talking about the tools we use, being connected to others, being in community, feeling purposefulness. You use the word spirituality and our spirit, and that's something that I find a lot of people ask about the Interfaith Counseling Center. What does interfaith mean, around these questions? And I even think sometimes spirituality is a word that some people very much associate with like religion. And so I appreciate us highlighting the piece of health in that, and talking to, I try to, really talk with people and have people help to identify that sort of piece in themselves of, feelings and your connection to things and what makes you happy and what makes you feel comfortable, what makes you feel safe, so that we can kind of bridge that body mind with those pieces.
I love that. And I just, I said it a little bit ago, but to restate that there is so much data backing up that sense of you're being involved in something bigger than yourself. You're kind of having a sense of hope. You're seeing something that will live on past you. Those are such strong predictors of physical as well as mental health. And one of the things that I think we most have to combat in some of our younger, most at-risk kids is that sense of hopelessness. One of my colleagues in Boston did this Boston youth study with high school students in the city of Boston, and found that one of the biggest correlates of being involved in violence was believing that you weren't going to live past age 35. So there was this whatever, it doesn't, right? And ditto for substance use or smoke, right? It's it doesn't matter what I do. I might as well take risks. I might as well do things that aren't healthy because I'm not going to live past 35 anyways. And so I think finding what gives you that strength and that sense of resilience, and whatever you want to call it, if it's nature, if it's God, if it's some other sense of kind of spirituality, is critical to both our physical and our mental and emotional health.
Thank you. That's a really important point in our work and the people we partner with and I think that is really what makes a big piece of our work kind of unique, in that it's about the counseling and the connection, but also the piece of care along the way of just everybody matters and we value you because you're you and you called, and so whether we connect you to our services or we connect you somewhere else, or you don't need further connection, that just making just having that exchange, like you said, we never know those interchanges with people, how the ripple impact that they have. And that's, I think, a really important piece of the work of the Interfaith Counseling Center. And I know our partner organizations as well. And I can hear in your work as well. So we have a couple of questions that I want to get to make sure that, and I appreciate people putting questions in the chat about how, when individuals may be struggling with coming out of isolation,
right,
and coming out of how do we help people with that transition? And I think and the question is including children who feel a sense of fear of maybe getting an illness when they get back to school.
Absolutely. So, the first thing that I'll say is that if you don't have to jump both feet back in, right?
I feel like you should say that again.
Take it at your own speed, right? I think, in-person dining has been open just about this entire pandemic. I'm still not doing it. I've been fully vaccinated since January. To me, it is one of those things that it's simply not worth the risk with the percentage of folks that are currently unvaccinated still. I'm not, outside of, if I'm in someone's home and everyone else is vaccinated, again, I'm going to do that for the first time tomorrow night. So I think, and again, I've been fully vaccinated since January. So take things slowly. you don't have to shed your mask just because you're not required to wear it anymore. It doesn't mean you're forbidden from wearing it. I do think that there is a little element of pushing yourself. You know, I'm going to tell you again what I said to my daughter with a middle school discussion, which is, you know, sometimes you do have to push in order to grow. Any of us that were ever athletes, even, you know, weekend athletes, know that if you don't kind of train hard, sometimes you're never going to get better. And there is a value to kind of gently letting yourself do things that may feel slightly uncomfortable. Try taking your mask off outdoors when you're at 6 feet distance from people. Try spending time with other people who are fully vaccinated. If you're fully vaccinated and your grandkids aren't, spend time with them. And not that you want to be a COVID denialist, but let yourself kind of reassure yourself that it's okay. And then for kids, I think, again, it's that reassurance. It's us modeling the safety. And also us giving them an out, a safe space. You know, the way that I remember when my kids were toddlers, that people used to tell me the fact that they were acting up at home was a good thing, because it meant that they were, that they felt safe with me, and that then they could go be wonderful little children in preschool.
Right.
And I think the same thing is true here, is that you create a safe space for your children or your grandchildren or your nieces and nephews to talk about their fears and worries. And you don't want to denigrate them. Like, they're very real feelings, and the feelings are okay. But at the same time, you can articulate why being back in person for many kids is the right thing right now. And all the safety precautions that the schools are taking. The other thing, of course, is to get your kids vaccinated as soon as you can. So if they're 16 plus, they can already go. Age 12 plus, hopefully on Monday, we'll get the FDA emergency use authorization, I'm hoping. And then the younger kids, hopefully by early fall.
Wow.
Fingers crossed.
That's exciting. What?
I can't wait for my own kids to get their vaccines.
That feels significant and quicker than I think I expected. Yeah. I appreciate the idea too of, you know, I think sometimes there's this idea that when, you know, we move forward from something, like all of a sudden we're just going to have those, you know, you have feelings of grief, kind of, you know, we have grief feelings. We may have feelings of, this is uncomfortable. I might feel afraid. I might be happy too. And it's kind of the same thing with, you know, counseling, or I know we talk about this in the nonviolence training, that like, we're going to have all these feelings. It's how we act on them and what we do with them that is kind of the next thing. So we may still feel,
I love that. Yeah.
You know, we may feel really uncomfortable or feel super comfortable, but we still kind of have to, you know, look at what's in our best interest, what's in the service of our best health, because we may feel like super ready to roll and take our mask off and go to a concert, but still, you know, we have to make our decisions for what's in our best health and have all those feelings as we move along.
And be comfortable with the discomfort. And be comfortable with the transition, which is like the toughest thing. Yeah. Being comfortable with all of our feelings is, and I think that's an important piece of almost stigma with counseling, that people think once you have worked on something or had some feelings on one thing, sometimes there's this idea that, okay, I'm done with that. Like, that's gone. I shouldn't be sad anymore. Yeah.
You know, or I shouldn't be angry at that person anymore, or angry at myself. And that, you know, that those feelings, that, you know, feelings are very elastic, or like you know, someone once said to me, like a bouncing ball in a room, that sometimes it's still and other times it's bouncing all over the place. And that just being okay with accepting that, seeing that, kind of giving yourself some grace and some acceptance and moving on. So I want to be really mindful of time. I think I know some of the questions I got ahead of time, we covered, because people were really interested in our conversation and your perspective. So we got some ahead of questions because people were worried that the chat,
Yes.
yeah, I think we hit those areas. I want to remind people that there is a link in the chat so you can donate tonight, and do you feel like we hit all our topics that we wanted to discuss?
Thank you. I do. And I will just kind of put in that final plug, which is again, that you guys do really, really important work and make a huge difference for both the folks that I see in the emergency department and for the folks who you manage to keep out of the emergency department. And also not just for the patients themselves, but for their families. And I know you and I have talked about this as well, but the degree to which you look out for that ripple effect, and help families navigate these processes and challenges. And I both want to thank you for that. And I will again put in another plug for people to donate, because it makes a really big difference.
Thank you. And I think that ripple effect is an important piece for all of us to recognize and feel a part of, that every one of us is part of ripple effect everywhere. So I want to just encourage everyone to feel appreciated for the ways in which they participate that, and to continue to care for ourselves. I want to remind everybody too to follow the ICC and you and the Nonviolence Institute on social media. And again, if you're able to support our work to providing mental health care to all in need, you can do so in the chat, or you can email us or go to our website, and also check out our Facebook page. We have we had a theme of connecting through COVID. So we have a beautiful piece of art donated by Jennifer Martirano as a way of connecting with others, and it's there. And then we also thought the time of outside gatherings and fire pits. So there's a fire pit on Facebook to bid on. And I want to thank the ICC board and our staff again for their very dedicated and resilient care, and all of our supporters and our partner organizations. And I'd like to give a special shout out to our sponsors who are in our whole box there, to Falvey Cargo Underwriting, to Blish and Kavanaugh, to the TGC, to Dennis McGuire, Barton Gilman, Embrace Home Loans, Dave Kavanaugh, Quest Diagnostics, Daley Orton, and Jennifer Martirano. And again, please check out her artwork on Facebook at the ICC page. And I look forward to continued work with you and supporting as we can. And I'm so appreciative of your sharing your time and talent and expertise with us tonight.
Well, it is truly absolutely my pleasure and my honor. I am appreciative of what you do. So it's a treat to get to be here with you.
Thank you. Thank you. Will be exciting to see what happens next. And I'm excited to talk about digital ways of connecting and
We're going to dream of all kinds of fun stuff together to help your clientele and nonviolent. Yes.
Awesome. And I'm appreciative of everyone who came to listen to, it's strange to see attendees number and not to be able to see faces and interact, but please everyone know that we appreciate you listening and watching and being with us, and excited for any ways that you want to participate in this ongoing conversation and supporting health and wellness and in our community here in Rhode Island, because there's so many ways to do it, whether you're part of the ripple effect or volunteering or donating. So thank you. And I'm going to have Monica switch us back to screen share so we can see our thank you to all our sponsors. And again, thank you so much, Dr. Ranney, for being with us here tonight. It was awesome.